Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome today, for the first time, Margaret White. You are the Program Director at Life Bridges Adult Day Program at MAC Incorporated.
Yes.
Welcome.
Thank you. Thank you for having me.
And that's the topic of the program.
Yes.
You'd like to talk to our audience and give important information about the Life Bridges program. It's new and it isn't, right?
Correct.
It opened in January of 2020.
That is correct.
And then just a few months later, you had to put it on hold due to COVID.
That is true.
But tell us about Life Bridges, what it's about, and how it came about.
Okay. Well, Life Bridges is an adult day program that is held at the MAC Center in Salisbury. And even though anyone can attend, it really focuses on those individuals that have an early to mid-stage dementia diagnosis. And you are correct. The program was opened in January of 2020. Unfortunately, as a lot of people were affected by it, the pandemic had us close our doors in March of 2020. But that didn't stop us. We still kept focused and looked at different ways that we could reach out to our clientele. And we did do that. Later on in the year, we were able to reach out to them at their homes. So even though there was a lot of guidelines, we were able to be outside and meet individuals one-on-one and give them about 2 hours of programming at their home. And so.
Well, as we know, COVID was very isolating for everyone, but particularly for dementia patients. So that's wonderful you were able to kind of get back in touch with people. Because you had about, 16 people in the
16
program?
to 18 people that were signed up and really appreciative of the program and needing the program, the caregivers, that is. And when we had to temporarily close, that really had a large effect on those individuals that relied on our program, which actually was a respite for them. It provided that service and the program for the person that they care for, but it gave them also a little break, a little respite. Some people worked, but some people had other obligations or things that they had to take care of, even if it was just taking a break for themselves.
And when did it start back up?
We actually opened our doors in April of 2021. And when we opened, we still were doing some one-on-ones, but because you had the guidelines, everyone getting vaccinated and things like that. So once it started in April, but by the end of April, we were back running together in a group and socializing as a whole.
So important.
Yes.
Now, I know this shouldn't be confused with the actual senior center at MAC, which is now called Connections.
That is correct. Prior to the pandemic, they referred to it as the senior center. It opened in May of 2021. It also was closed temporarily. And when it reopened in May, they renamed it Connections. Nice. That is a day program. It does have a larger number of people that attend. These individuals are more independent, able to make choices, and our clientele do as well. But our clientele for Life Bridges may need more cueing and coaching, some more direction, oversight, some supervision. But so the senior center, now referred to as Connections, has anywhere from 20-some, it could go up to possibly 40 people at a time. It just depends on the day.
And that's open Monday through Thursday, 9:30 to 1:30.
Correct, yeah.
I've been there quite a bit. That's quite the tight-knit group.
Yes.
They all know each other and it's quite the social environment from what I've observed.
They do. They enjoy themselves. They appreciate the socialization. Their friends, when they could return, they were very excited. So when they opened back up, they couldn't wait to schedule it and to start returning. Now, our program, Life Bridges, is a smaller group, and there's different reasons for that. One, having a diagnosis, whether it's mild cognitive impairment or a related dementia, sometimes a larger group can be overwhelming. So that smaller group, we're looking at about a number of 12 to 16 people, and that makes it a less ratio between staff and participants, and we can focus more on their needs.
Right, so. And of course, I visited Life Bridges, and it's a secure area, though.
Yes, it is.
It must be, just in case anyone could be a wanderer, so to speak.
Yes, there could be a participant that with their diagnosis, there may be some wandering possibilities, and we just want to keep everybody safe and secure. And there's a number of people that do not wander. but just in case. It's for everybody's safety.
And what else makes you different from a typical daycare program?
Okay.
What makes Life Bridges special then?
Okay. Well, due to the fact that we focus on those early to mid-stage dementias, we are looking at a dementia activities for them that focus on things that will keep them stimulated, engaged, interacting with each other as a social program. We may have sensory type activities, but we also focus on music and exercise, movement. We really try to touch base on a multitude of things, but that it keeps them involved. And with that, looking at the program that we schedule, we're looking at individuals. We want to find out, what their interests are, where their strengths are, what their backgrounds are, and we want to try to create a program that they would be interested in. But we always say, don't count anything out, because you might find you like to do a number of things you never tried before. So.
Sure. I know I was there. It was a very home-like, comfortable setting with a variety of activities and things for people to engage in, either themselves with the help of a staff member or together as a group.
True. And some are able to do more and some need a little bit more assistance. But we really promote that independence, but we give them that support that they need. And it may be a little cueing, a little reminding. But the area is not really large. We have a couple activity areas. And depending on the day, if we do have, 12 people that are attending, we may choose to kind of utilize both rooms. So we may have 4 to 5 people in one room, a number of people in another room, and try different activities with them. So it just depends. Some people might like to do, crafts or some sort of creative activity, painting. Someone else might like music. And so we just try to look at that and make sure we offer things that they're going to enjoy doing.
Well, it sounds like you have a nice selection of more dementia-friendly type activities with music and reminiscence, and which is all shown to be very effective. But the other thing, if I recall, is you also had like a quiet area.
We do. Thank you for asking for that. We have a Serenity Area, and it's just a quiet area, and we have a little Chase Lounge in there. And it may be that, not everybody has to be busy all the time. Somebody might come, they might be a little tired. They might want a little one-on-one time, and or they just might want to get away and just listen to some music, have some time to themselves. They can utilize that location.
Right.
And we've had people that have laid down and take a nap, or they just do something on their own.
Right.
They want to step
Sometimes
away.
you can get overstimulated.
Yeah, they just want to step away from that group for a little bit.
Because you were open all day, correct? Monday through Friday?
Yes, we're open Monday through Friday, 8:30 to 4:30. Originally, before the pandemic, we were open a little longer, and that's something that we will consider. But right now, our hours are 8:30 to 4:30.
I know the other thing that we discussed, and I know makes you special, is you do train your staff in dementia communication strategies, because you do have to talk differently to people with dementia.
Yes.
Keep it simple and so forth.
Yes, keep it simple.
And that's very important.
Yes, it is, and we want to keep that education going. We want to provide as much as we can to them, and answer their questions. And we have staff that have background experience in the area of caregiving and of working with those with different types of dementia. But we can always learn more and always be aware of how to provide that care and service to our clients.
So if someone's interested in terms of having a loved one they think would benefit from this type of day program, how do they get information, or what do they do?
Okay, well, several ways. They can call into the Mac Center, and I know we're going to mention the phone number, but I can do it again, 410-742-0505, and they will direct them to the right person to talk to, which would be myself, Margaret White. I'm the program director. Or they can actually direct them right into the program where one of the staff members can talk to them. But if they are interested and they want to go ahead and make arrangements to have their person that has the diagnosis attend the program, we would set up an evaluation or an interview to sit down, kind of break the ice, get to know each other, make everyone comfortable. But it's our opportunity as a Life Bridges director, it's my opportunity to get to know them and find out more about them and to make sure that the program is right for them. Because we are a social program. The Life Bridges Day program is a Senior Center Plus, is a social program, and it differs from the medical adult day programs. So
Margaret, it sounds like there's a continuum there at MAC where perhaps I imagine some people have been coming to Connections for years, may get a diagnosis of some early dementia, and may benefit more from the Life Bridges day program. And then I'm sure there's some people that either apply to or while they're in the program may progress with their dementia, and it's no longer a match in terms of what you can provide for their needs.
Yes, that's true. If somebody is currently enrolled in Connections and they need more than what Connection can provide them, then we will meet with their family members and we will evaluate them for the Life Bridges program. And we've had a few people actually do that. Those who are within the Life Bridges program at times, as they start to need more than what we can offer them, that's when we discuss with them about possible other options.
Right.
So if it's making a decision to consider a medical adult day program who offers more hands-on care than we do at Life Bridges. We are a social program, so we do more of that oversight or that cueing and coaching. The medical adult day programs, as mentioned, does more hands-on. And then there's other selections or choices that they have too.
Right.
And we will help guide them through that.
So if someone is unfortunately progressing with their dementia and they need more physical care, or they're incontinent, or they're having lots of behavioral issues, and that may be the time to
Right. And not that we wouldn't have those type of issues within Life Bridges, but it's manageable. It's something that somebody can be redirected. We can refocus them and keep them engaged in a certain activity that they're interested in. And when it comes to incontinence, someone that might need additional care, as long as they're able to manage that a certain degree on their own, we can offer minimal assistance with that. So just because they may be incontinent doesn't mean they cannot attend the program. So that's why we'd like to actually sit down and take the time to evaluate, get to know them, and find out what their needs are. And then we can share with them what the program can and cannot do.
And is there a fee for this, or a sliding scale arrangement you can work on with families?
There is a fee, and that's a difference between Connections. One of the differences between Connections and Life Bridges. Connections runs with or on donations. Life Bridges, focusing more on those early to mid-stage dementia diagnoses, we do have a fee. But we also take into consideration household incomes, limited incomes, and we have a sliding scale that we can consider.
Well, very good. I'm sure people can discuss that further with you if they get the evaluation. That's part of the evaluation,
It is part
I
of the
imagine.
evaluation, yeah.
Now, I also know you wanted to discuss some other services related to dementia care, such as support groups.
Yes, because as I had mentioned that the program, Life Bridges Day program, benefits those who are participating as well as the caregiver or the care partner. It provides them a respite. But along with that, we offer to the caregivers other things such as support groups and educational opportunities. So MAC actually oversees 4 counties. That's Wycomico, Worcester, Dorchester, and Somerset. And we do have support groups that are offered within those counties, so they can contact me and I can tell them more about that and make those arrangements for them. But with the education piece, we do have different workshops. But one of the opportunities that the caregivers have is with an evidence-based program called Savvy Caregiver. And that is a program that's offered, it's a 6-week course, 2 hours each week, but it helps them to take the skills and knowledge they have and build on that and give them the confidence as a caregiver to be able to even be a better caregiver and to understand the diagnosis and the different stages and how to work with their person and keep them contented throughout the day. But also it has a section where they focus on the caregiver and self-care and really taking care of themselves as well.
That is also important to have a healthy caregiver, because it's very stressful caregiving, you know, from personal experience with my parents and such. I think that's such a wonderful thing now. We're seeing more and more of this, like educating caregivers on the communication strategies that work best. So that sounds
It's so
really
important. Knowledge is so important, and having that information, and not just for themselves, but for their care team, because caregivers have families and friends and medical professionals, and having that information and being aware helps.
Well, it sounds like some
tremendously.
great things going on over there at MAC. I'm
Yeah.
so glad we're back to where you are
Definitely.
providing many of these services that had to be put on hold for a little while there. So wonderful job you're doing over there. Like I said, I visited myself. I was quite impressed with the whole environment and ambiance and the kind of things you were doing with the participants. So
Thank you. We try to make it a very comfortable environment, but we enjoy our time with them as well, and we just want to give back and make sure we can offer a program that they'll enjoy.
well, that's the great thing about MAC. They're giving back in a lot of ways
Yes.
for the senior community. Now, we'll post information at the end of the program, the number they can call, and of course there's a website. They can get a lot of this information on the website as well.
They can.
Well, thank you so much, Margaret.
It was a pleasure. Thank you
I
for
was
having
so
me.
happy you could come in and enlighten our community about this wonderful service.
Thank you. We appreciate your time.
And thank you for joining us for this edition of Focus on Health here on PAC 14.